I think when it was first, when we were first doing this, this was going to be a regional kind of level talk. And so that's why it talks about a bullying harassment survey. And hats off Sunny with Pam and Neil Kang, who've turned this into something much, much bigger and better. You've got some really cool speakers like Deepa, Prim, Deborah Eastwood, Tim Briggs coming along. So I hope everyone who's tuned in has really appreciated what you've done. It's been phenomenal. And thank you for asking me. So we're going to talk about leadership and negative behaviours. And it's amazing how much overlap there is between what Deepa's just told you and what Prim spoke about before as well. So what are we going to talk about? We're going to talk about what constitutes negative behaviours, why it matters, what's it got to do with your leadership and management teaching, and some practical stuff about actually making changes, okay? So as everyone has mentioned, this stuff is on agendas everywhere. So the GMC started talking about it at the beginning of the last decade, the BMA. So these are the documents that I'll be referencing through my talk. But you can see the BMA, the RCS, and the BOA have all brought this into the spotlight, and it's gaining a lot of momentum. So quick poll, and if we could make these quick, that would be great. But the first question is, so BOTA did this in 2016, didn't they? Have you ever experienced, and they broke it down, but I'm just going to put it all together, bullying, harassment, or undermining at work. Are we able to ask our participants that?
Yep, we'll just get that poll going very shortly.
Okay, I'm going to carry on. Okay, so that's going to be the first question. So what are these negative behaviors we're talking about? And we've just talked about the big three. Okay, and this is stuff that you will all be aware of. You've got bullying, which is behavior that, frankly, frightens people who are less powerful than you. Okay, you've also got undermining, which is about basically weakening people and wearing away their confidence. So these are the two that you're hopefully most familiar with. Okay, well, not that you've experienced, but you know what I mean. I've got a bit of a problem here. I can't move slide because it's making me vote, but says, there we go. Harassment. Now, this is about violating someone's dignity or making an environment that's intimidating, humiliating, or offensive. And unfortunately, I think sometimes the trauma meeting can be such an environment. And the big thing I wanted to highlight here is that you don't have to prove that the behavior was intended to cause those effects. Okay, so in employment tribunals, it's about the weight to the perception of the recipient of the behavior. They will see, is that reasonable? Were they reasonable to perceive that they were being harassed? But it's not that, oh, you were intending to. Even if you unintentionally do that, that's a bad thing, which sounds obvious. Right, so our result here is 89%. That's, is that surprising? I don't know. We'll talk about that at the end. So moving on. But the RCS document talks about disruptive behavior, and there's now talk about negative acts as well. And what is this? This is about things people say or do which will interfere with the delivery of quality of healthcare or safety. So basically, one individual's actions and words that are impacting on the safety of our patients. And as Prim said, that's the bottom line, isn't it? That's what it's about. When you look at the RCS document, okay, yells or uses foul, insulting or demeaning language, disrespectful or puts down others, criticizes or belittles the abilities of others. I have to say, I think you're all probably aware of people that have done this in a work setting. And when they interviewed doctors about what kind of bullying and negative acts they'd experienced, it's things like being exposed to an unmanageable workload, okay, being humiliated or ridiculed in connection with your work. Some of this stuff we see every day, and we need to start calling it out, don't we? Now, the next question I wanted to ask everyone is, have you experienced unconscious bias at work? And you've got three options here: yes, no, and I don't know, which might be you don't know what I mean by unconscious bias. So please be honest, okay? So if we could get that poll up, that would be great. Is that all good, Sunny?
Yeah, it'll just take one
yeah,
more.
Cool. Brilliant. So actually, can you guys answer that? It's going to be there, and I'm going to wait a second just to see what answers come up. So we're not going to call you out. Okay, if you put yes, I'm not going to make you answer what that means. Right, hopefully you'll have all voted, so I'm going to move on now. So what do we mean by unconscious bias? Wow, okay, 75% have said yes, 4% no, and 21% don't know. I think the thing is, when you're listening to a talk like this is someone who's engaged in this topic, isn't it? And I think that's probably right at that 75%. So this is about your social stereotypes affecting how you treat people. And Prim touched on this, didn't he? And what's important is we all have them, okay? And it's much more prevalent than conscious bias. And if someone said it to you, you'd say, no, that doesn't fit with my values. And unfortunately, certain scenarios working under time pressure can bring out these attitudes and beliefs. And so we're a really good melting pot for these behaviors, aren't we? When you're working, a busy on call, all of this stuff is going to come out. And in the types of bias, I'm not going to describe each of them, okay, but be aware that there's these 3 different types. And it basically fits to things like, well, you're either in my in group or you're not. And if you're in my in group and you do an operation and it went wrong, it's because it was a difficult operation. If you're in my out group and you did it and it went well, it's because it was an easy operation, wasn't it? And then when you do things, I'm looking to fit it into what I already think of you. Those are very simple breakdowns and examples. And I have to be honest, I wasn't aware of this stuff in any detail until about September, when one of our trainees organized really good teaching about unconscious bias. And then you've got the micro inequities. Okay, these are small unintentional events. And it's basically when you feel people are different to you. But checking your emails or text when you're making a face-to-face conversation, I think this, I've heard from some of my colleagues and my wife, making eye contact only with males whilst talking to a mixed gender group, consistently mispronouncing a person's name. I can tell you, I've never heard Sanghrajka said quite so appropriately and accurately until about 3 years ago. It's been really impressive. So does it matter? You guys have all heard about civility saves lives. I'm not going to go through the data there, but actually the evidence is yes, it really does matter. It impacts on work and it impacts on lives. So finally, you've all, a lot of you said you've experienced it. A lot of you said you feel unconscious bias. The final poll I want you to answer is, have you personally ever done something about it or seen someone do something to deal with these behaviors? And your options are yes, and they did it well. Yes, but they didn't do it very well. That's all objective. No, you've never seen anyone even try. And in the final group, there's some of you who've never seen bullying, undermining, or harassment. So you'd have to say, no, I've never seen it. So if we could have that poll set up, and that's going to come up on screen, but I'll carry on, okay?
Thank you.
And then the question is, and I think this is the important question, is we all know it's there then. We've all said we've experienced it, most of us. How are we going to change things? And what I hope is that the trainees on my program will tell you that it's something that I do take seriously. And I think it's all about this. And Prim talked about visions, and he talked about, one of the discussions we were having offline was, how do you try and make everyone share a vision? And what do we mean by culture? Okay, now it could be the culture of your department, the culture of your hospital, or the culture of your profession. And it's about shared ways of thinking, feeling, and behaving. Okay, now here it's the definitions about healthcare organizations, but you could apply this to BizCos, you could apply this to the BOA or the RCS. And our societies are changing their culture, and we're seeing solid evidence of that. They've been brilliant. And what people have said is that you should view healthcare organizations as comprising multiple subcultures. And that's why I've got this Petri dish here. You can see that here's orthopedics, here's anesthetics, here's the physician group, okay? We've all got our different subcultures. Hopefully your trust has a constitution. It has its overriding principles. And these subcultures could drive good change, or they may undermine it. So culture is really important. And if your organization values certain things in terms of its culture, so you can see the poll coming up there. Remember, yes, you've seen someone deal with it and they did it well. Yes, they tried, but they didn't do it very well. No, they didn't even try, or no, I've never seen it, so I can't answer this question. Okay. And then, so if your culture values something, for example, if your culture is really research oriented in your department, you're going to do well with that. If, on the other hand, you don't care about research, you're not going to do well in your department. And the same applies to all of these things. Right, okay, so the results are there. About a quarter of you said yes, and it was dealt with well. 40% said yes, no, not well. 25% no, it wasn't even dealt with, okay? I'm actually slightly impressed, I think, with the only about a third of you felt that it wasn't even dealt with. I thought that number might be higher. But yeah, what we want to do by the end of this talk, and when you become leaders, hopefully I'm going to give you little bits that you can take away so you deal with it better and you don't feel afraid about making changes. So if we're saying that you will only do things that you feel strongly about, then actually you guys are going to have to be the change. Okay. As a leader, you're going to change the culture. And really that starts with checking yourself. You're going to look at those behaviors that I've listed. There's a hip hop reference there for those of you who got it. And you're going to see how many of those apply to you and how much you need to change. Because I think we all demonstrate some of that. But it's proven, okay, the leaders will set the tone of your organization, be it your department, be it your trainee group, because you can determine what is normal, what's going to get rewarded, what's going to get punished, and what's going to get prioritized. And there's a big drive for collective and compassionate leadership. And I have to say, I think that with the guys that have set up stuff around my training program, and it's not me, we're seeing this, okay? A lot of this is going around. And it's really important that people in senior positions don't turn a blind eye. We've got to see what they can do to challenge that behavior. You're going to be the guys to stand up for that change. And yeah, frankly, lead by example. It's a cliche. I had to throw some of those in as well, didn't I? So compassionate leadership, okay? The second most common answer amongst doctors for the cause of bullying, undermining, and harassment is that it comes from the top down and it's difficult to challenge. The King's Fund interviewed chief executives and they felt that this comes from the politicians. It comes all the way from there. And unfortunately, this stuff filters down. And compassionate leadership is not common in hierarchical organizations, okay? So bullying, undermining, and harassment is common when there is strict hierarchy with what they refer to as destructive leadership styles, okay? The autocrat, the guy who's going to tell you what to do. Or just as bad, okay, is the laissez-faire, the relaxed leader. And by being relaxed, it doesn't mean that they're good. They're just not bothering to lead, okay? So that's when things go wrong as well. So what are you going to do? You're going to ask, and then you're going to listen, and then you're going to speak. What you want to do is find out, is there a problem? Frankly, we all know there is a problem. You're going to improve your own understanding of what constitutes these negative behaviors and educate the people around you. The way to find out whether there is a problem around you, as well as talking, because you need objective evidence, is with surveys and feedback. And that's what we did in our program. When this stuff is going on, we need people that witness it to be more active and speak up. So you'll all have heard about bystander training, and I think we need more of that. We need to teach the victims, for want of a better word, and the bystanders to challenge the protagonists more effectively. And it's things like calm and non-confrontational approaches rather than the aggression that you might see in some of the meetings. Now, in grey, I've put here freedom to speak up guardians. Okay, this is something that you've all probably got in your trusts. I don't know how much experience you've had with them. I think they're important, but that's not something you're going to be able to institute or implement. But the other things we can do ourselves, okay? The Vanderbilt University Professionalism Pyramid, this is a really good structure, okay? So it's about, if someone does one bad thing, take them for a coffee and have a bit of a chat and say, you know what, that wasn't great. Unless it was a really, really bad thing. And you think, you know what, this is unacceptable. And then you're going to go up the pyramid. If it becomes a pattern, then that's when you start becoming formally involved, okay? One of the problems I think sometimes is you want to catch these problems early with the cup of coffee rather than letting it get to this level, okay? But this is a hierarchy or a structure, and they've shown that if you follow this, it makes things more, you deal with it more effectively. And then does that mean you're not allowed to feedback? So something I commonly hear is, oh, I can't talk to the trainee or I can't talk to this person because then they'll just accuse me of bullying and harassment. Something that you guys saw, hopefully, that Prim did, and he always did, is he's quite frank, okay? He's not going to dress it up, and he'll tell you, but it's because he does demonstrate this, okay? He cares personally, but challenges directly. And this is called Radical Candor. It's from a book by someone called Kim Scott in America, and it is taking off. And you've got these 4 quadrants in your feedback, okay? So radical candor is the ideal. The other 4, okay, obnoxious aggression. This is actually the second best approach, apparently. And it's where all you care about is the results. You forget that actually the person you're feeding back to is a human. And people prefer this to the other 2 quadrants on this side because they'd rather work for someone who's an arse and who's going to point out what your flaws are rather than say nothing and just pretend everything's okay, which is on the other side of this grid. So ruinous empathy, this is the person who really wants to be nice to you. They don't want to hurt your feelings. So they don't want to say anything, but actually they let you carry on down the wrong path. Okay. And that's going to result in bigger problems for you in the future. And then there's this group, which I personally think are the worst. Okay. They're staying silent. They'll say what they think you want to hear, but it's not because of you. It's what they want to achieve. It's their own political gain. So for all of us, we want to be in this quadrant. And if you're in this quadrant where you treat people like people and you actually care about them, but you will feed back when they're making mistakes, you're going to see them change and you're going to hopefully make them improve themselves. Okay, so no, this isn't about you've got to be nice to people unless they deserve it, but you are going to treat people like people. So how are we going to create this? So the first thing is you've got to change the culture of the people. Okay. And then the problem is, this is the harder part, okay? So 2/3 of doctor, the first reason, I told you this, the second reason was they feel it comes from the top down. The first reason about bullying and harassment is because people are under pressure. How are we going to do this, okay? How are we going to deal with these high workloads, rotas, IT issues, staff shortages? And how are we going to give people a space and time to spend time with each other so that they're not in this melting pot and they're not just having to deal with problems in an office where there's loads of other people? I don't have the answers to that. And I think that's the bigger challenge in all of this. So I actually think we can change our own culture and behavior much more easily than we're going to be able to change these things. Doesn't mean we shouldn't try, but you can all change today and change those other aspects. This stuff is going to be much harder. So what did we do? Okay, where did this all come from in terms of this? We realized that there are some issues. BOTA told us there are issues, and we wanted to look at what was going on. So this was run by our program. So I set up the SurveyMonkey. It was loosely based on the BOTA survey. We made it short and snappy because you've all got survey fatigue, but it was an important topic. I wanted to know what our trainees felt. It was about the units that they worked in for the 12 months, and we sent it to each of them after the changeover. Anonymity was promised and was given, and we sent them 2 reminders. And then we analysed our results at overall and unit level. And I can tell you overall, we did better than the BOTA results. Now, this is all anonymous, okay? But here's, basically I've blacked out the scores. I don't want anyone to work out anything. So what we did do was feedback, because there's no point in doing these surveys and one of the big reasons why people don't respond to surveys, they don't raise their hands up and say there's a problem, is they think you're not going to do anything about it. So if you're going to go down this route, if you want to lead change, you've got to make change happen. So we fed back to a couple of the units, and they changed their cultures, or they're in the process of doing that. They changed the way they run things. But I think the biggest thing is actually they showed an interest, and the change that they're trying to drive might not make all the difference straight away. But one of our units went from being the worst unit in our region in terms of the Training Hospital of the Year survey to being the 3rd. Okay, so not 3rd worst, 3rd best. And that's because they care about things, and they've changed the culture, and they're using the results to drive the change they want to see. So in conclusion, okay, what am I going to say? You're going to lead the change, but if you want to do that, look at yourself. Look around you, okay? Who's going to help you and who is not? Who are the problems? And this is what Prim was talking about, getting a team around you, okay? And yeah, there had to be that reference as well, didn't there? Here's the big person that needs to change. He's got an idea, but we don't agree with it. So it's a group of people who all think the same, who are going to drive that change. It's hard to do this on your own. You might be able to lead that group of people, but you need to find them. As I said to you, I think changing the culture is easier than changing the system. And this is really difficult stuff. Leadership is very difficult. I don't think anyone's given you any easy answers. And it is difficult dealing with difficult people, which is why normally they're given a wide berth and they're allowed to just get on with the way they are. And this is Google's code of practice, okay? So you can Google code of conduct. I don't know if you've heard this, but this is what they started with. Don't be evil. And then they've added it, actually. It was modified, and at one point it was taken out. But actually, this is quite a cool mantra, isn't it? Don't be evil. And if you see something that you think isn't right, speak up. And leaders need to do that and then be the change. But even if you're not the person leading, you need to do this, okay? So that's me done. Thank you very much.
Anish?
Prim.
Well, thanks very much. I think it's always brave when you're in a leadership role to do these things. It's very difficult to do these things and then honestly deal with the answers that come back. One thing I feel is that I would say 95% of trainers are so passionate about training that in the heat of how these things are constructed, anything that sounds negative impacts so hard when you're a TPD on their morale, that it's a really tricky game for us to play, I think, and you and certainly Deepa would have found this before, is trying to pick them up and say, this is not saying that you're a bad trainer.
Yeah, not at all.
This is not saying that you're a bad department. I'm not saying this to you. This is more a thing for all the trainees to understand, is that we have to then pick these people up because they are all so engaged in training. And a lot of them want to change. And until things like this are flagged up, they don't even know a lot of this is how an action is perceived. And there's the whole thing in my leadership course around what you have complete control over is your intention with any given action. But what you have no control over is the impact of that action on someone else. And you can't tell them what the impact should be because your intention was X. It is entirely independent of your intention that that impact is felt. And until you tell them, I know you felt that the impact was going to be, the intention was X, but the impact was Y. It is a very hurtful thing to hear, but at least on the trainer's side, I can tell you we're all in a position where we want to hear because we want to change. There is so much we went through that was unacceptable. And it's very easy for me to say to my trainees now, Yuda, what are you moaning about? If you knew what I went through, right? But nobody is saying that, right? Nobody as a trainer is saying that. And I'll tell you, I'm going to use this as an opportunity to just flag up a point that I bring up from time to time, which is around resilience. Now, one of the inadvertent things of the horrible behaviors before was it taught us all resilience. And I don't want that behavior to continue so we can learn resilience. But at the same time, I will say to people, we have to teach our trainees resilience. One day you are going to tell a parent that their child has died. You're going to tell a parent that their child has got a recurrence of their bone tumor. You're going to tell someone that their mother passed away under your surgery, right? And if you don't have resilience, I can tell you, these are incredibly difficult things to do. Now, we inadvertently learned that resilience because we had other bad aspects of our training that taught us, and it wasn't formal. But I keep imploring TPDs, the SAC, and my trainees that there has to be formal teaching and resilience training, not to excuse bad behavior from trainers or bullying or undermining, but because the line of work we're in with all the good intention, we still end up with things going wrong and having to break bad news and then take that burden with us home. And it is incredibly tough to do. There is no easy way out of it. The first patient that dies for you on the table, if you don't go home and not sleep and feel awful, then you're not that empathic doctor that we're all trying to develop.
Another question from Raza Hassan. Thank you for your question. What do you think about the culture when someone tries to show himself or herself a hero and thinks everyone should work all day, all week and round the clock? What do you think about this behavior?
That's a really difficult question, isn't it? So the first thing I'd be thinking is, why are they doing that? Okay. And I think everyone's different. And actually, if that person's doing that and they're doing it well and they're happy doing that, as long as they're, I'd want to explore and make sure it's not having any impact on them. I wouldn't want them trying to make everyone else do that. And I think that's the thing that we've got to be clear about, is that it might be good for you, but that's not what everyone needs to be doing. And if you're doing it just to show everyone else up, then that's not a good thing, I think. Is that, what would the other guys say? Deepa, Prim?
Yeah, it's a tricky one, isn't it? I mean, you, as you say, I think you have to get to the bottom of why they're doing it. And some people just like working all the time, but obviously it isn't acceptable to expect everyone else to fall in line with that. But I also think, I think Prim is right in that the way that we were brought up through the system is that we automatically developed a certain resilience and a certain attitude. And very often it was a point of pride that we hadn't been home for 6 days. But actually we need to sort of move to a culture where that isn't a point of pride, because it isn't. why haven't you been home for 6 days? It's not something to be proud of. So we need to move away from that culture.
I agree with both what Anish said and what Deepa said. I think the key thing here is Anish's point in his talk about a culture that you create. So although for an individual, you probably want to sit down with them if you're mentoring them and say, what's going on that you have no other interests? Because work-life balance is a key thing for sustainability in our profession. But the other side is, as a leader, you don't reward that sort of behavior. What you do is very visibly and transparently to everyone, you're rewarding the behavior of the mother who's bringing up a great child, or the guy who's a triathlon gold medalist, or the other guy who's doing charity work, or all these people who are doing it differently, the less than, and we don't use part-time anymore. Deepa, you didn't mention that, but that came up at the SAC. You guys used it, but we call it less than full-time training. We cherish all of those people equally, and that's the role that the leader can execute very visibly, so that suddenly the culture doesn't transform. And the culture Raza is describing is very, very reminiscent of 1980s American banking, right? If you took a day off or you didn't go home, American law firms are still the same. It's a real culture. So if you go to an American residency program, they get 2 weeks of vacation a year, but they only ever take one. And anyone that takes 2 weeks is seen as a weakling and is not going to cut it, and certainly won't get a job at that program. We've always been much, much better in the UK at recognizing that, firstly with the 6 weeks. But I think to Raza's point, I think it is great. Somebody anonymous has said, where can such behavior be reported? If that's pertaining to this person who's working all around the clock, it's difficult. Even your word of reporting it suggests that I would say this person has a problem. Right. And I'm worried about this person, and I certainly don't want anyone else in the department to emulate it. I really want to sit down with this person and find out what's going on. Why are you driving yourself? Are there problems at home? Are there things we can help with? Are you worried about stuff? Are you struggling? Do you feel you need more hours to get the training? So to that, I would say, if it was in my hospital, I'd love another trainee to just say, hey, I'm worried about the person Raza is describing. Is there any chance you can go for a coffee and sit down with them and just explore it? Because that's how I view this. I don't view this as gold medal behavior. Yeah, sorry. I think my connection, I've got some workers in. No, you can't reward that sort of behavior is what I wanted to say. And I think that's the key thing. There are people who are going to be, there are people who work harder than me and achieve more than me. And people look and they win awards and they win stuff, right? It doesn't belittle what I do. It's about making sure that the average person in that department, whether it's a trainee or a consultant, is performing in a happy, friendly environment and delivering what they're asked to do for their patients. Now, there will always be amongst us, I said this in my talk, where we are as a collective group incredibly intelligent, incredibly ambitious, somewhat competitive, which is not necessarily a good trait amongst us, but we are people who will deliver. So taking the highest delivering person and setting that as the benchmark is only going to result in unhappiness. So what you do is you take the average as the benchmark and you constantly try to raise that bar. Right? And let that person is working and they're going to get the awards, but that doesn't mean that you're falling behind the bar. And I think it's down to the leadership to make that culture very clear to everyone so that everyone's happy. If everyone was like that, you'd have a very unhappy department.
And I think we have one final question. Challenging, it's from Hannah Wilson, thank you. Challenging a person's unconscious bias can be very difficult. Do you have any tips for this?
I'm constantly looking for them is probably the answer. Do you know, I think the first thing is actually making people aware of this stuff. I think a lot of people don't even know what unconscious bias is, and they don't believe it. And then the first answer you'll get when you talk to someone about it is, well, how can I know about it? It's unconscious, ha, ha, ha. So actually, once you start educating, and that's, I suppose that's what I was saying in my slides, is you've got to talk about it. You've got to talk to everyone about it, highlight what negative behaviors are. And then I think what you see is people start changing, whatever they might say, whatever the front is. Once you make it clear that these things are not appropriate, things do start changing. Okay, so today's talk was a little bit shorter, but I normally, when I give this kind of talk, I put up a slide of the Benny Hill show, which many of you may not know. I reckon Prim and Deepa will remember the Benny Hill show. And there was a program that was a little bit before my time called the Black and White Minstrels. Okay, that was where Caucasian people put face paint on and pretended to be people of an African origin on BBC. It was primetime viewing. And the reason why I talk about those things is that was completely normal in the 70s and 80s. Okay, it was people watched it, laughed at it. My parents loved the Benny Hill show. I watched it with them, and this is about some guy who was in his 50s running around with semi-naked women. When I was putting these slides together, my 10-year-old looked at those pictures and actually started laughing and was kind of horrified at what is this on your laptop. So things do change. We can change attitudes, and we're seeing that. So I think that with the kind of push that we're getting from the Royal College of Surgeons, the BOA, I think we're going to be able to make these changes. And I don't think it's got to be slow. I think actually we've just got to start talking about it and just accept that this is not acceptable anymore. And then, yeah, maybe make people feel negative about those negative behaviors. So that
I agree. I think it really is about getting people to see, because, I mean, as you quite rightly said, you know, it's a joke, but actually they are unconscious. And once people start to realize it, once you bring it into their conscious brain, then you find that, you know, they have something to work with. It's a lot harder to deal with than something that's overt, but it is there. I mean, similar to what you were saying before, Anish. I mean, I don't know if you all know about the IAT test for unconscious bias. If you don't know about it, I highly recommend you go online and Google it. It's the implicit association test, IAT, and you can do it for all kinds of things to see if you've got gender bias or racial bias or all kinds of things. You can just do it very quickly online, and it will show you whether you have an unconscious bias. And you know, unbelievably, I have done the IAT for gender bias, and the first time I did it, it showed that I have an unconscious bias towards males in positions of authority. And the first time I did it, I couldn't believe it. I was like, that's got to be wrong. So I did it again. And I had the same answer. And then I did it again because I was annoyed now. I was furious. And I got the same answer. And that is because that is a very deeply entrenched belief, obviously, because of my environment, my upbringing, lots of different things. I had no idea that I had it. So I think if you sort of help people to see, and obviously it's not easy to do, but once you bring it into people's conscious brain, then it changes.
I am not as positive about this as either Anish or Deepa, in that I think it's still a huge challenge. And Hannah, to your question, it's not just talking about it. It's all about the trust of where you can feel that you can trust someone to take this information, preserve your, if you're a trainee especially, preserve your career progression and your integrity. Take it silently, deal with it appropriately, and yet you can trust them to then get the end point, which is the learning for the person with the unconscious bias. And when Anish talks about the bigger organizations, so whether it's the BOA or HEE for training, I have to say my personal experience is that I don't see that I trust them to deliver that end product. And I have much more faith in Deepa doing it locally or Anish doing it locally. So the people I know who are having conversations like this with trainees and a wider and more diverse and inclusive group, whereas I still feel our organizations are treading through treacle and there's a fair amount of tick box exercise behavior. And now that is very unfair on the people who lead these organizations who are trying desperately. And for them, I would say recognition is the big step. But the majority of them are in a position where, you know, they did this recently looking at all the subspecial groups in orthopedics and showing they're predominantly still white male. so I still think we have a way to go. And Hannah, I wouldn't openly talk about this yet. If you were my trainee and I was giving you advice, I would find that senior mentor, somebody looking after you that you trust, to talk about your weaknesses and all of that stuff and flag it up with them and trust them to take it and deal with it in the right way. I sadly still have to say, as trainees, my advice to you always is still be overly cautious and protective about your career progression, because people will say everything's out in the open. My personal experience, even now, is that it isn't. Sorry to be cynical, but I've earned my reputation by being honest with everyone I speak to, and that's honestly my view at the moment.